Many people are living with a breast cancer diagnosis. The survival rate following breast cancer is good. Around 85% will be alive in 5 years. For the majority, the cancer would have been treated and it won't come back. Now, the risk of breast cancer recurrence depends on so many factors, and different types of breast cancers have different risk profiles. We know that the risk of recurrence for all breast cancers is highest in the first 5 years of diagnosis, and this is at around 10%. The risk is actually highest in the first few years after diagnosis. If your cancer is estrogen receptor positive or ER positive, your cancer recurrence risk is lower compared to those with ER negative disease or estrogen negative disease. But beyond 5 years, those with ER positive disease have higher rates of recurrence. There are other factors that may increase the risk of cancer recurrence. Number 1 is age. The younger you are, the greater the risk of recurrence is. Number 2 is lymph node involvement. This refers to whether any of the lymph nodes in your armpit had cancer cells at the time of diagnosis. The more involved the nodes, the higher the risk of recurrence. Number 3 is the size. The larger the size of the cancer, the higher the risk. Number 4 is the grade of the cancer. The higher the grade, the more risk recurrence there is. So a grade 3 versus a grade 1, for example. And lastly, if your cancer is ER and PR negative, in other words, they don't express the estrogen and progesterone receptors, then the risk of recurrence is increased. The other factors that can affect recurrence risk is lifestyle factors. Smoking and excess alcohol increases risk, whilst exercise and maintaining a healthy weight can markedly reduce recurrence risk. So how is breast cancer recurrence detected? Well, the best way is by doing a self-breast or chest examination. The things to look out for are any lumps, any skin changes, any skin thickening, any rashes, any dimpling, any change in the shape of the breast, as well as spontaneous nipple discharge. It's also important to examine along the scars for any nodules or skin thickening, as well as lumpiness. The other thing is also to be aware of any nipple inversion. The other way of finding whether breast cancer has recurred is from your yearly or annual mammogram checkups. If you have had a mastectomy as part of your breast cancer treatment, does that mean that you can't get a recurrence? The answer to this question is, unfortunately, you can still get a cancer recurrence even after a mastectomy. A mastectomy removes most of the breast tissue. However, around 5 to 10% of breast tissue is unintentionally left behind. And that's because it's just impossible to remove 100% of breast tissue at the time of a mastectomy. And so breast cancer can still recur either on the skin flap overlying the chest wall if you are flat and didn't have a reconstruction, or if you had a reconstruction, then the recurrence can happen on the skin overlying your reconstructed breast. It can also recur along the scars. Any treatment you get after a mastectomy is given to reduce the risk of cancer recurrence. And so if you have radiotherapy, then that is to reduce the risk of local recurrence, as well as local regional recurrence. If you have chemotherapy, immunotherapy, or tablet treatment, then these are given to reduce the risk not only of local regional recurrence, but also of distant recurrence. Local recurrence means that the cancer has come back locally, so in the breast or on the chest wall. Regional recurrence means that the cancer has spread to the lymph nodes or glands in the armpit or nodes at the base of the neck. And distant recurrence means that the cancer has spread to other parts of the body, which can either be the lung, liver, bones, or the brain. So the first way we can detect local recurrence is simply by doing a self-examination. And for anybody who has had breast cancer treatment, it remains important to continually be examining yourself and being aware. This is certainly true whether you've had a lumpectomy, whether you've had a mastectomy and have gone flat, or you've had a mastectomy with a reconstruction. Examine yourself with the flat of your hand and fingers and do this once a month. What are you looking for when you are doing a self-examination? For local recurrence, you need to be examining your breasts, whether that is your own breast or reconstructed breasts, and If you've had a mastectomy and you have gone flat, then you should also be examining your chest wall. Doing an examination along the scars is also very important. You are looking for lumps or nodules, thickening of the skin, or any change in texture. Dimpling is also something you should be looking out for, as well as noticing spontaneous nipple discharge. If you notice any of these changes, then do get them checked out. Now, it doesn't mean that they are definitive recurrences, but if they are new, it's best to get a doctor to check them out for you. For regional recurrence, you should remember to examine your armpits as well as the areas just above your clavicles or your collarbones. What you're looking out for or you are feeling for are enlarged lymph nodes or lymph glands, and they will feel like prominent nodes and are quite obvious to feel. The second way we detect recurrences is by performing scans. Now, if you've had breast cancer treatment, these are normally mammograms that you will have once a year for at least 5 years following your cancer diagnosis. Or when you reach the age of 50, that's when you will be getting your annual mammograms. And the reason why we would still do mammograms regularly is because not all recurrences will be palpable or will they present as lumps. Some recurrences can only be seen on mammograms, especially DCIS. If a lump is palpable, then an ultrasound scan will also be done. So how about distant recurrences? Well, as mentioned earlier, the areas that breast cancer can spread to include the liver, lungs, bones, as well as the brain. Now, occasionally it may spread to the lining of the stomach or appear on the surface of the skin as nodules. And the symptoms really does depend on where the cancer has gone to. If the bones are affected, then bone pain can either be a dull ache or sharp pain that isn't going away and there's no history of trauma. If the liver is affected, then the symptoms could include a sensation of bloating, abdominal pain or discomfort, especially in the upper outer aspect of your abdomen. You may also feel tired and have no appetite. Lung symptoms, they may be a non-productive cough, sharp pain when breathing or shortness of breath. Brain symptoms may include dizziness, nausea, mood swings, unsteadiness on your feet, fatigue, vomiting, and visual disturbances. And lastly, spinal cord compression, which is a rare red flag symptom, but one that needs urgent attention. And the symptoms may include severe lower back pain that doesn't go away, numbness or electrical shock sensation, pins and needles down your limbs. You may experience weakness, numbness in the area around the back passage, and inability to empty your bowel or bladder and problems controlling the bowel or bladder. Now, if you get any of the symptoms, you should get urgent medical attention. It may be nothing, but it's best to get them checked out. I hope this has been helpful, and I'll see you in the next video.